Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, my special guest today is the Attorney General and gubernatorial candidate Tom Corbett, and then continuing our series on health care, we're going to take a look at multicultural health care needs in the state. Pennsylvania politics in depth and in detail, and guess what? It all starts right now.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back. Well, shameless promotion time. We're in our 13th year. I want to thank our viewers all over the state and on WGAL. We continue, guess what? To beat Fox News Sunday, to beat This Week on ABC, we virtually tie Chris Matthews. Not about me, it's all about you. I want to thank our loyal viewers over the 13 years for hanging in with us. Pennsylvania politics in depth and in detail. And I'm turning now to the Attorney General of the state of Pennsylvania, Tom Corbett. General Corbett, welcome back.
Thanks for having me back again.
All right, look, there are a bunch of things in the limited time that I have with you. Let's get right to them. Look, you filed this lawsuit, man. It's like you dropped this. It's a lawsuit. You say the National Health Care Bill approved by Congress a couple of weeks ago is unconstitutional. You and 12 of your colleagues have filed a lawsuit. Boy, it has struck a nerve. Supporters on your side of the aisle.
Detractors on the other side.
Yeah, I know. I was going to say, and detractors on the other. In a couple of sentences, why did you do this?
Because we believe it is unconstitutional. We believe that that requirement that a person must buy health insurance or be fined and receive a fine of $750 a year or more if it's a family that's involved is really a bridge too far. It is an expansion of the Commerce Clause of the United States Constitution much further than the founders ever thought we'd be going. And we believe that it should be tested. It should be tested in the court. Besides the 12 of us, there are many governors across the United States that believe that it should be done. But I can tell you the number of phone calls, the number of letters we have received, both pro and con, for the lawsuit. Those supporting the lawsuit far outweigh the con in this. But that's not why we did it. I knew this would get a reaction like this. But as the Attorney General of the Commonwealth of Pennsylvania, I have a duty to uphold not only the Constitution of Pennsylvania, but the Constitution of the United States. And we believe that this abridged the Constitution, not only the Commerce Clause, but also with the 10th Amendment, which, as you know, reserves those rights not enumerated in the Constitution to the states. So that's what the lawsuit's
it'll be an interesting test case on the, someone who a good bit of his career when teaching American history and American government taught parts of the Constitution. Be an interesting test case. It is a pretty expansive view this health care bill takes of the Commerce Clause. Right. It's never been quite extended that far into the private sector. So, rightly or wrongly, I mean, I think it will be a huge case.
Oh, absolutely.
Do you agree with that? A huge case, regardless of the position that you have on it.
And really, the people need to focus on what the case is about. The case isn't about health care itself. Everybody talks about that, and I believe everybody thinks, and we agree, that we need health care reform.
Right.
But what this is about is, does the Congress have the power to reach directly into everybody's pocket and say, you must buy something? It comes down to that. Right. Really, it comes down to, do the ends justify the means?
All right, well, I mean, but look, the case is not like, it's hard for me to imagine that this will be decided before the end of this governor's campaign anyway. I mean, you know how the Supreme Court
I would be the most
works.
surprised person involved in this. It would be that quick.
I mean, it could be even pushed off. As you know, most of these decisions are handed down late spring by the court, by the Supreme Court now. So it could end up being whoever's the new governor, as well as who's, obviously the President Obama and the Congress would have to deal with whatever decision. But we're talking about well into a year. Would you agree?
I would agree, at least a year.
Okay. Finally on this, there was criticism of your office for, well, you're going to use Commonwealth resources and lawyers and all of that. What your answer to that?
We have joined on with a lawsuit that was filed by the state of Florida. They take the laboring oar in this. We are assisting them. We're doing research with them. But the cost of this is not that great. But I would make this observation: there is no price limit to the cost of defending the Constitution of the United States, as far as I'm concerned.
Okay. All right, let's turn now to the more immediate matters. The next, Governor Rendell has proposed a $1 billion increase in the state budget this year. It's about a 4.1% increase, passed by the House of Representatives, Democratic control, let's be candid. in the Senate, Republican control. The Republicans have said dead on arrival.
Right.
What do you like or don't you like about this? Now, look, who's ever governor is going to have to live with half of this. Do
Absolutely.
I got that right?
6 months.
That's right. That's right. All right. If General Corbett is Governor Corbett, give us your assessment of that budget.
Well, first off, I think the budget has to go in the other direction. I don't think it can grow. Since the governor took office in 2003, we've increased the spending of Pennsylvania by over 40%. Last year, the governor tried to get this $1 billion, and you saw we ended up in over a 100-day delay in getting the budget, and the Senate told him no. It hasn't deterred him. He continues to want an additional $1 billion in spending. We don't have the money without substantial increase in taxes in Pennsylvania, and I don't believe we should be increasing the taxes. I can tell you from traveling all of Pennsylvania, there is no will on the part of the people to increase their taxes right now.
We're going to go to a break. When we come back, I want to ask you a couple more questions about the budget, and then maybe the big thing, the pension, $4 billion in pension costs due. If not more, we'll be back with the Attorney General of the state of Pennsylvania after we pay some bills.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania. This broadcast of Pennsylvania Newsmakers is presented by PAConstructionJobs.com. For more information about rewarding careers in the highway construction industry, visit PAConstructionJobs.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back. I'm talking with the Attorney General of the state of Pennsylvania. He's also a gubernatorial candidate. We've invited, by the way, all the gubernatorial candidates. They're welcome on here. General Corbett is welcome back anytime he wants to come on the program. All right, General Corbett, let's talk about another thing. I mean, okay, you want to cut down the spending and you want no taxes. What would the 3 or 4 initiatives right out of the starting gate for a Corbett administration? With jobs and economic, whatever you think your imprint,
right.
You want your
well,
imprint.
The very first thing would be to follow up on what I've called for already. I've asked for a special session of the legislature, the governor called one, on the economic recovery and the pension issue here in Pennsylvania. We've not seen that yet. I don't think we're going to see it by the time I would become governor. So that will be one of the very first things we do. Secondly, government reform. And as you know, we were talking about it recently at a HAC forum. That is incumbent that we have that here in Harrisburg. I think the people expect it, and if you listen to the candidates, they all seem to be in conformity with me.
So you're all the candidates pretty much in agreement.
Right,
the culture has to change.
That's exactly right. Then, obviously, we're going to be dealing with the budget. We've got to reduce the spending of Pennsylvania. We've got to get that under control. Part of getting that under control is starting to go in and cut the cost of government, cut the size of government, and cut in, not only in the governor's side, but also on the legislative side. As you know, there's close to 3,000 employees that work for the 253 members of the House and the Senate. And cut some of the funds that they hold off to the side. So I think the first year of the next governor's administration, hopefully mine, should be saying no, no, and no.
But you also have some initiatives on the economic development and technology that looks an awful lot like the Ben Franklin Partnership, which was started by Governor Thornburg. By the way, I was on the board appointed by Governor Thornburg a long time ago, but go ahead. Technology, economic development, what's your sense about that?
Absolutely. We've issued a policy perspective on our website at tomcorbettforgovernor.com. 3 of the 7 points have been issued there, one of which is innovation, embracing innovation. You know, we're in a new century. This state has to embrace that innovation, and doesn't have to do it through additional costs to us. It can be done through research and development. It can be done through embracing the free enterprise system. We need to get much more broadband to many sections of Pennsylvania, particularly rural Pennsylvania that doesn't get it, and make it competitive, but look to business to get there, not the government making it available. But we have our cell towers and everything across Pennsylvania that we can use that on. But you're right, some of this is very similar to the Ben Franklins. We're going to need to find that private sector money, those bridge loans to get these small companies. And I've traveled all of Pennsylvania. We have a number of very good small companies in what I call an incubator status here in South Central Pennsylvania, and Southwestern Pennsylvania, in the life sciences, the biotech, the medical devices, the high technology, similar to what's going on in Carnegie Mellon. A lot of spin-off companies coming out of there that's going to need just a little bit of investment to develop more jobs. And then, of course, we need to help develop the Marcellus Shale industry.
Well, that's gotten to be not controversial, I guess, in two regards. You know, doing it should be how fast should it expand, and then the taxes. Talk about that a bit. That's not unimportant. That's pretty important.
Well, it's very important. In talking to one of the CEOs, one of the major gas companies here in Pennsylvania, they believe, and if you look at the Penn State studies, it's about 500,000 new jobs in Pennsylvania between now and 2018, 2019. That's a lot of jobs.
So you're in favor of continuing to expand the development of the Marcellus Shale?
Absolutely.
And how about the taxes?
First off, you need to expand it. You need to do it with the environment in mind. The regulatory environment has to be there. But the regulators have to be working with the companies, not in opposition, not as adversaries, but with the companies. You know, sometimes the regulators sit back and wait for something to happen and see something go wrong. They see it coming. Well, they should be in there with the companies and no, you can't do it that way. You have to do it this way. These companies, their permits to drill that is as much value to them as what the gas is under the ground that they're going to. You know that this is a big industry because I think ExxonMobil came in here a couple of weeks ago, maybe a couple of months ago now, and purchased a company up in the Northwest for $41 billion. So you know that they're going to come in here and they're going to do it right. What I look at is let's get the income from the royalties from the state lands that we've leased. Let's get the income from the individuals who are receiving royalties now because they're going to have to pay taxes on that, and let's see where that is. I really don't think we need a severance tax at this point in time. Okay. That's the shortcut to getting some money. We need to wait a little bit.
Okay. Well, believe it or not, we're out of time. We didn't get to a couple of the other subjects, but I want to
thank. Goes by quickly.
Yeah, it does. Thanks for coming in. All right, multicultural healthcare needs. We continue our series on healthcare. What else? It's healthcare 24/7. We'll be back with healthcare and more following these words.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. All right, we continue our series on healthcare. We're going to talk about multicultural healthcare needs. Joining me is Dr. Rhonda Moore Johnson, Deborah C. Davis, and Geeta Devi. It sounds like there's your movie star name. You ought to be in Hollywood with these names. Dr. Johnson, let me start with you. First of all, what is health equity? You hear that term. For our viewers, explain that to us.
Yes, health equity refers to, in general, unequal treatment that minorities often receive when they enter the healthcare system. You know, the landscape of America is changing, and in the state of Pennsylvania, minorities represent the fastest growing segment of our population, with African American population now at 12%, and Hispanics and Asian. The Hispanic population is growing at 30-some%, and the Asian population is also increasing in the state. So we need to make sure that these populations receive care, because they represent a growing percentage of our citizenry.
Mm-hmm. Now, when we take a look at, you know, okay, we understand we now have a definition. What are folks doing in the healthcare system to try to alleviate this concern, to try to make healthcare more equitable?
Well, at the Hershey Medical Center, I know there's a number of different initiatives that are taking place. And one that I would like to share with you as an example addresses HIV and AIDS. And we are a designee, the medical center is a designee for the Department of Health. It's a grant that came out in 2007. And the grant is to expand HIV testing in minority populations by integrating, which I think is important, by integrating testing into routine clinical care in emergency rooms, community clinics, and correctional facilities. It's a statewide initiative, and we're very pleased to be a part of that. Additionally, I know there are some studies going on, one in particular that's looking at the HPV, the human papillomavirus infection among HIV/AIDS patients in rural Pennsylvania. There's been quite a bit of work that we're doing to address the rural population.
And you're PinnacleHealth.
PinnacleHealth.
And you're also, there seems to be a growing movement, but go ahead, tell me what you're doing.
PinnacleHealth, to start with the basics of the location where we are located, we are actually at an advantage of multicultural communities, and Pinnacle has been very proactive as far as that is concerned to go to the root of it. First, we are educating our employees, orienting them with what tools are available at Pinnacle to serve the minority communities. We are reaching out to the communities by getting their leaders involved and communities involved to see what minority needs are and how we can excel in our services for them.
Just in general, I mean, we've had this big national health care debate. We don't have to get into whether, the costs and all that, but do you think that overall, is the problem covering more people, that more people have to have health care coverage? And, I mean, talk a little bit about what you think.
Health care coverage is a major problem, of course, because we have so many people who are uninsured, and minorities are disproportionately uninsured, particularly Hispanic and Latinos. So part of the solution is to increase access. The other thing we have to do, we have to address the problem of disproportionate burden of disease among minorities. So, for example, minorities in Pennsylvania have a greater proportion of certain types of cancers. They have a higher incidence of diabetes, and the diabetes is often poorly controlled because of this access issue and inability to get care. Hypertension is a problem. HIV/AIDS, 9 out of 10 persons with HIV/AIDS with new diagnoses are people of color. And this is a major issue here in the state of Pennsylvania. That's why you see growing partnership between entities such as Highmark and insurance companies working together with hospitals and the health departments and community organizations to try to address these growing burdens of disease.
All right, we're going to we're going to run to a break. I'll come to you when we get back. I also want to get into this issue of training physicians and nurses and all to deal with the special needs. All right, we'll be back. Healthcare 24/7. We've been doing this for a long time. We're going to keep doing it. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
Hi, welcome back. All right, Geeta, you wanted to make a point.
I wanted to make a point particularly about minority issues with hypertension and diabetes and high cholesterol and those. And I'm very proud to say that Pinnacle is very active in that, headed by Dr. Joshi, and she has done a lot of work with diabetes in minority, giving free education, giving free testing, blood testing, and getting them into the hospital when it is needed. And that way we have in fact reduced a lot of trips from minority patients to the emergency rooms.
And a lot of the wellness a lot of these wellness programs are really aimed at, you got to get these diseases early. It's cheaper, am I right? It's cheaper in the long run to get this stuff done.
Absolutely.
For everybody. Now, I know you're all involved in training physicians and nurses for a more multicultural set of patients. How's that going?
Before I address that, I just want to say that there are a number of initiatives when you talk about disparities that are impacting minorities. And for example, cancer. We have several projects. I won't go into detail at this time on those, but one in particular is addressing the community within Allison Hill in Harrisburg. It's a new project that's received funding, and it's going to focus on prevention, control, treatment, awareness, working with individuals, African American females who are survivors of cancer. Now, when it comes to training, we do quite a bit, and because we believe it's important for all of our employees to have a stronger awareness of the various groups that we serve, our patients, and also be able to communicate them in the most effective way. Cross-cultural communication looms loudly when you're working with groups with different cultural and ethnic backgrounds. We provide on-site Achieving Cultural Competency in Healthcare. It's an interactive workshop that I teach along with others, raising our employees' awareness, knowledge, and skill set. So it's about the applications, not just about knowledge.
Okay.
For physicians, this is going to address Highmark. We have a number of our physicians who are involved in quality interactions and online e-learning experience. They get CME credits for doing that, and the service is underwritten by Highmark, who is our insurance provider.
Now I think you wanted to say something about the healthcare plans and cultural competency, and go ahead.
Yes. Highmark has undertaken a major initiative to train our employees. So nearly all of our employees have had diversity training. All of our clinical serving employees have had cultural competency training, and we've offered this training out to our physician networks. We do this through online training, through partnerships with hospitals, for example. We've provided grand rounds and training and conferences to doctors throughout the state, both in western, central, and eastern Pennsylvania.
We have about a minute left. You also think that minorities have a responsibility to do help themselves. Say quickly.
We want everyone to be in the best health possible. So that involves seeing your doctor regularly, knowing what your risk factors are for diseases, and engaging in preventive care. Stop smoking. Get the needed tests.
Don't drink so much.
30 minutes of exercise a day.
Brush
your teeth. Take care of your floss. Get the screenings that you need. Know your numbers, your blood pressure, your cholesterol, your blood sugar, and engage yourself in the healthcare system.
And sure, that's where Pinnacle has been very active with Highmark.
All right, guess what? You get the final word. Look, I want to thank, we've been trying to cover all aspects of this healthcare, not just the debate, but the important, aspects of healthcare, what people should do. All right, as always, thanks for watching Pennsylvania Newsmakers, and guess how I end this? As always, stay well.